Well, I have a screen for everybody else that they are seeing, and it has a picture of you. And just very quickly to introduce Jenny to you guys, she's a lover of everything ragdoll cats. She's the founder of Floppycats.com. She's the author of multiple books. She's been featured on BuzzFeed, Rover.com, Wikipedia, and more. She has the website Floppycats.com if you guys want to check it out. It's pretty cool. She's done a lot of work because she absolutely adores these cats. And so she's done a fantastic job of that. Now, with every speaker, I just want to introduce them, and I want to say something. I don't know all of these speakers really well. I'll just be honest, personally. Like every one of them, I don't know personally really well. But I've observed a few things about each speaker, and I wanted to share just really quickly one thing that the three characteristics of this speaker that I've observed that I appreciate. Okay, for Jenny, I chose honest, unassuming, and caring. Those were the three things that as we've talked have stuck out to me. She tells you what she thinks, and I love it. Unassuming, she's humble, she's not like pretentious in any way. I love that, and she just caring. She cares about her audience. She cares about her cats. She's very kind that way. So those three things stuck out to me about Jenny. I am now going to stop sharing. I'm going to turn it over to her. She can share her screen again. So she's going to give her a quick second to share her screen. We'll figure this out. I'll get out of the way and let Jenny talk here in a second. But Selena says, knew you from Mariposa when you could come see Captain Jack. So somebody is already saying they know who you are. And
that was a long time ago. Yes.
All right, you're presenting. It's up. Everything looks good. You guys should be able to see your presentation. I'm going to jump off.
Thank you, Jonathan. Okay, guys, bear with me because I do not present very often, and so I'm nervous. So hopefully this all goes well. It is thundering and lightning here, so I'm also hoping it will go well because of that. So Jonathan asked me to be here today to talk to you about administering ozone on a cat as a cat owner. So even though I have a website about floppy cats, I'm here today as a cat owner. And I was introduced to ozone because of I was introduced to it because of this cat right here. His name is Camus. He had chronic kidney failure, and that's why I'm speaking to you, because it all started with him. So you might be wondering who I am. Jonathan already introduced me, but yes, I founded Floppy Cats 15 years ago, all because of a childhood cat named Rags. I've been writing and learning about cats for 15 years now. And again, I'm just presenting today because I'm a cat owner who administered ozone on Camus, the cat I already talked about, and then my two cats. So Camus was my first ozone cat. He was my parents' seal-mitted ragdoll. He was a soulmate cat of mine. And shortly after the pandemic, it was discovered he was in later stages of renal failure. He had missed his regular vet appointment because the vet wasn't seeing, cats that were just coming in for wellness exams. So he ended up, my mom was saying he was vomiting and sitting by the water bowl all the time. And that's how it was discovered that all of a sudden he was in later stages of renal disease. And I wasn't seeing my parents because of COVID, and I wasn't seeing their cats, and I would have picked up on it too. But anyway, it was just terrible timing. So once I announced on Floppy Cats that Camus was diagnosed with chronic kidney disease, a reader reached out and told me about a presentation she had seen with Dr. Margo Roman, who is speaking today, which just blows my mind that I'm part of something where Dr. Roman is speaking. But Dr. Roman had mentioned that ozone therapy really helped a patient of hers that had kidney disease. So that's when I first heard of ozone. And on Camus, I ended up doing rectal ozone, ozonated saline sub-Q, and ozonated saline orally in his mouth. These are my two yahoos. On the left is my seal-mitted ragdoll cat, Charlie. He's 14. At the age of 12, he started to have major food sensitivities and allergies, and I've given him ozonated saline orally and we've taken him to the vet for sub-Q ozonated saline. And then Trig, or who I call Chiggy, is on the right, and he's 14 as well. He's blue lynx-mitted ragdoll, and at the age of 12, he started to have allergies and bloating. And I've given him ozonated saline orally, and have taken him to the vet for rectal ozone as well. So after all of this ozone stuff with Camus passed away in December 2020, I decided to have ozone done on myself. So I went to a clinic here. I live in Kansas City, and what they do is they draw about a pint of your own blood. Then they take that, inject it into a saline bag, so a bag full of saline. And then once your blood's injected and mixed with that saline, and there's some other things that go in there, like anti blood clogging. I can't say the word. I'm too nervous. But they also inject ozone gas into that bag, and then it all mixes together, and then they put it back in you. So that's what I had done, and I really wanted to know if it would help, how it made me feel. And so what I felt the first time I had it done was probably the most, biggest experience that I had with it, or change. And it just was a general feeling of wellness. Like I'd actually had only 3 hours of sleep the night before. And so it just made me feel like I had slept well, like I had eaten well and exercised. So it was a neat experience to kind of know what it felt like. As far as the benefits of administering ozone that I saw with my cats, with Camus, it was that the biggest change was his energy levels. The day that we were going to take him in, I'll get to this, but it was very difficult to find a veterinarian here that did ozone. I must have called 7 or 8 vets, and finally someone told me that someone 30 minutes away was doing ozone. And so it took a little while to get in and get an appointment. And so by that time, Camus was pretty listless. And I said to my mom, like, what are we doing? Why are we putting him through this? And she was like, Jenny, we have the appointment. Let's just go and see how it goes. And I'm so grateful that we did. But so he went from listless, not even wanting to lift his head, to walking around. And I will show a video too of how different he was in a minute. He had less nausea. If you're familiar with kidney disease, there's lots of nausea associated with it. And he started to eat more. And then also kidney cats have problems pooping. So all of, inserting something into the rectum will always kind of stimulate it down there, and it always helped him poop. And then with my cats, it's helped with just a reduction in itchiness during seasonal allergies. So here is a video of Camus after his treatments. Camus is getting ozone now 2 times a week, and we might reduce it to once a week. But this footage right here of him bunny kicking my flip-flops was taken right after that clip. When we got home, this is the behavior he had. So yes, you saw him very uncomfortable, but then you can see that he got home. He had a lot of energy, wanted to eat, wanted to bunny kick my flip-flops. So that 2 or 3 minutes is so worth his quality of life afterwards. He also has started bunny kicking his banana, rubbing his face on it, just having more energy overall to be a cat and feel good in his body. He also started cleaning himself again after we started ozone. Like I said, he was listless before we started ozone. I don't know how long this is going to last, but the fact that it has given him a quality of life means the world to me. And then after our 5th or 6th treatment, he started kneading again, which is also incredible. Okay, so the most important thing, I think, before you even start wanting to do ozone at home is to work with a veterinarian that's experienced with ozone, see how your cat's going to respond to it, or your dog, before you start getting all the equipment and everything like that. For example, my cat Charlie, who I showed earlier, he there's no way that I'm going to ever be able to do rectal ozone on him ever. Like that is a no entry point for him, and that's off limits. Even the ozonated saline sub-Q for him was a screaming nightmare. So I can only give him oral ozonated saline. But Camus was an incredible patient. My cat Trig is an incredible patient. So I knew that this was a possibility. So it's really important to know your cat or know your dog and know if they're going to put up with this. So Dr. Linda Ferris, who is now retired, was the one that was doing ozone 30 minutes away. And she was the one, because of her experience and everything, that deemed the concentration and the dose and depended on the condition. And so she started out with a very small dose with Camus. We came back 2 days later. She increased the dose a little bit more. And then the third time was the dose that she always wanted him to be on. So it kind of like increased until she knew that like his body could handle that. And it's important to know that not all veterinarians offer it. They have to be trained in it, and they have to have an ozone generator, oxygen tank, ozone resistant tubing, and syringes. So I talked about, will your cat tolerate a catheter going in and up their anus/rectum? Camus, due to his disease state, needed ozone on a regular basis. And treatment might require several sessions depending on the severity of the ailment. And hauling him back and forth to the vet became cumbersome. So he was diagnosed in June and he died in December. And so we started ozone in July. And so we were going in the very, very hot months. It's very hot in Kansas City in July and August. And I was like, what am I doing taking a already dehydrated cat in a hot car, even though it was air conditioning, it was still just hot, back and forth so many times. So that's why I wanted another option. So I'm going to try to play a video again.
This is the catheter that we use, and it's lubricated. And then I lubricate my pinky thusly and insert it right into his little hind end very gently, because cats have two sphincters in the rectum, and it's very hard to get the tiny little catheter past both of them smoothly. Easy, buddy. Okay, now, can you hold his tail up gently? Just gently.
It's okay, honey.
He doesn't really like
It's
it.
okay.
So you can't see a thing, because what I'm doing is going up right along the edge
It's all
of
right,
my
sweetie.
pinky with the catheter. I can feel it going right up in there to the end of my little finger.
It's
A little
okay.
bit past it.
It's okay.
And there is just a tiny amount of fecal material in there. It feels like shreds of firm feces. It's not soft. And I'm just inserting, I'm pressing the plunger against me because my other hand's busy. We just gently put it in.
All right, baby.
Good boy. That feels so much better. Usually he doesn't make any sounds while I'm doing it. I don't know why. I mean,
Because we're here.
It's probably because you're here. Yeah.
Good kitty, Nui.
Yes, he's such a good boy.
And it's administered rectally just because it's absorbed better there?
It's absorbed easily and very well, very quickly. And so we have easy access to get it in smoothly, quickly, without much trauma. We can also ozonate saline and put it in sub-Q. We can ozonate blood and do different things with the blood, either put it back in the vein, put it in sub-Q, put it in acupuncture points. There are many, many ways to administer ozone. The autosanguis, which means to put it with the animal's own blood, is a really special medicine, and I feel like it has some amazing powers. I like to do it. I'm treating cancer patients with that a lot. It's more expensive, but it is just a really nice treatment. You don't have any chance of a reaction because you're using their own blood, so the treatment options are almost unlimited.
Okay, so the importance of ozone therapy, at the vet, like starting at the vet for me, is that it establishes a relationship with the veterinarian should you decide to do it at home. It allows you to see and experience how your cat responds to ozone therapy. It allows you to see if your pet health insurance will cover it. So this was weird, but I'm with Nationwide, and my insurance, or my mom was with Nationwide, but I am too. They covered ozone therapy at the vet, like ozonated saline, rectal ozone, all that stuff at the vet. But then when I actually got the equipment and submitted that invoice, they didn't cover it. But I do wonder that if I had purchased it through Dr. Ferris and it had like, Northland Animal Hospital on the invoice, if it would have been covered that way. So if that's a concern of yours, I just wanted to bring that up. Okay. Is everyone seeing the screen again? Okay. Man. All right. Now, when to consider to do ozone at home. Administering ozone at home might be an option when the cat's condition requires frequent therapy sessions, like in Camis's case, or traveling to the vet is difficult or it's traumatic for the cat. You want to consult with your veterinarian before administering any therapy at home. Never do so without proper education and training. And working with a knowledgeable, open-minded vet is crucial. If you have to work with multiple vets, make sure they can work together. I was so very, very fortunate that our current vet, Dr. Sally Barchman of State Line Animal Hospital, who actually offers ozone now, was willing to work with Dr. Ferris, and vice versa, that Dr. Ferris was willing to work with Dr. Barchman. So it was really awesome experience for me, even though I was dealing with a cat that I adored who was dying. And then know yourself. Do you have the intestinal fortitude to play vet tech and do this procedure on your pet? Not only was I emotionally drained from the thought of losing my cat, but I was also just like, can I do all of this? So it's nice that if you're here now and you don't have a sick animal and you're not, I was kind of in a panic stage when this was all brought to me. So then get prepared, ask your vet to show you how to do it in the office, take a video so you can reference it when you do it on your own. That's partially why I have these videos, is because I wanted to make sure that, I could reference something, and then ask vet techs for tips on how to insert catheters rectally in a cat, because my current vet, now I learned after the fact, but you can like kind of scratch back by the tail, because cats have two sphincters, and it will like open up the second sphincter when on trig, at least that's how it worked. And I was like, that would have been a great tip to know when I was doing Camus. I'm just going to verify that everybody. Okay. Thanks. I was checking the comments really fast. So there's like with Charlie, the one that isn't going to put up with, with Charlie, the one that isn't going to put up with rectal ozone, I've got to look at alternative treatments. And a lot of times, like some of the questions that were being asked to Jonathan at the start, yes, ozone's going to help, but it might not be the only answer. And I'm sure that, Dr. Margo Roman is probably going to bring up stuff like that. So other important therapies could be diet, herbs, essential oils, homeopathy, acupuncture, red light therapy, and the Assisi loop also helped Camus a lot. And they also have an Assisi loop lounge. So that's why it's listed there. So the hardest part for me were the oxygen tanks. And I saw Jonathan already talked about that too. I was scared to do industrial strength oxygen. I wanted medical grade for Camus. I was like, here's a diseased cat. His body is shutting down and I want medical grade. And so I went to extra efforts to find something. So you need an oxygen tank, a flow regulator, and tubing in order to pump pure oxygen into the ozonated generator. And one of the biggest struggles, like I said, was finding one. So Dr. Ferris had told me this, but it was just so much information when you're stressed out. So I didn't absorb it until later, but this was a great recommendation. She said to look on Craigslist for people that have passed away, their family members are left with their oxygen tanks and they might be like half full or I don't know, completely full, and they just need to get rid of them. So that's a great way to just get an oxygen tank that might have oxygen, and it might be medical grade. Your vet might have an oxygen tank supplier. Next door, same thing about the Craigslist thing. And then what I ended up doing was calling home medical oxygen companies. And at first, like, people thought I was pranking them. Like, are you kidding me? You're calling me about a cat? And so I started getting creative on how I would ask, like, I'm on a hunt today and I hope that you can help me. There's an opportunity here for you to change my day and make this thing that I'm hunting for, be finally resolved. So that's how I ended up doing it. Because a lot of times, you meet the person that answers the phone and you got to get to the person that makes the decisions. So it took me probably 3 days to finally find an oxygen tank. So the generator is what, you need to produce oxygen. You need the O3, you need the generator and the oxygen. And this is how I met O3 Vets, because Dr. Ferris used O3 Vets, so she referred me to them. And after speaking with O3 Vets on the phone, I decided on the hummingbird kit. And I literally told O3 Vets exactly what I needed to do at home with Camus. Dr. Margo Roman had spoken to Dr. Sally, and then Dr. Sally talked to Dr. Ferris, and Dr. Roman had suggested rectal ozone and ozonated saline on Camus. So I knew I needed the whatever to make those things. And that's how O3 Vets helped me out. So you need small items like ozone syringes, catheters, bubblers, pediatric regulators, and ozonated saline solution, which is a prescription from your veterinarian if you're doing what I did to Camus. So adequate storage, cleaning, and disinfecting space should also be considered. If you're going to ozonate saline or oils, I definitely suggest getting at least 2 bubblers, as I broke my first bubbler within the first week of having it. And Dr. Ferris actually gave me that tip because she said she had broken a bubbler and I am a major klutz. So of course I ended up breaking one too. The most common risks associated with ozone therapy include throat irritation, coughing, respiratory discomfort. This can typically be avoided by creating the ozone in a garage or with a window open. So I did all the ozone in the garage with Camus at my parents' house, and I do it in my garage now as well. Precautions is it's crucial to take adequate safety precautions when preparing and administering ozone and ozonated saline. I always tried to keep everything clean, sanitized, and always worked with clean hands. Again, consult your vet. Never administer ozone without consulting with your veterinarian first. They will assist you in determining how much ozone, how frequently, and will monitor your pet's progress. The other thing with Camus was he always pooped afterwards. So I learned this the hard way on the 30-minute drive home, that we would wait a little bit in the vet's office, and then if he didn't poop, then I would head home. But one time he pooped in the car, and here I am on a highway and I can't do anything about it. So what I ended up figuring out, and it's going to vary by patient, whereas Trig, when he's done rectal ozone, he can wait until he gets home, but Camus was a disease cat, so he was going. So actually I would sit in the parking lot with him until he went, and then we would drive home. So that's just a heads up that I wish I would have had. The way to get started before your generator arrives, this was really helpful to me, but watch O3 Vets' videos. They have some unlisted videos, or at least they did at the time, and Jonathan can clarify that, but you can ask them to send those to you before you get your generator. I have the videos on my YouTube channel, the ones that I've been playing for you here, or the portions of, and then you can also join Facebook groups like O3 Vets, so you have a support group. All right, administering ozone rectally. A lubricated catheter, which is what you saw Dr. Ferris put in, is inserted in the cat's rectum while ozone gas is inserted. The ozone will be absorbed through the colon into the bloodstream, where it will exert its therapeutic benefits on the cat. One of the most like relieving things for me was someone telling, it was either Dr. Ferris or Dr. Sally, that said the rectum isn't the cleanest area, so no worries on it being perfectly sanitized. And I was like, okay, because I was so scared. I was very scared doing all of this at first. I didn't want to, introduce more bacteria or more problems into Camus's body. So that really was a big relief for me. It's really awesome to have a helper. I was able to do ozonated saline sub-Q by myself, but rectal ozone, I really needed someone to like hold Camus up front. Just because when you put something in their anus, it's uncomfortable and they want to move and you need him to stay steady. So my mom or my sister would help, or my dad sometimes too. It's important to make sure they're calm and relaxed. So my mom, I always put her at Camus's head and she would massage his neck and do what she normally did with him. And then I would work on getting it in him. I told you about the cats having 2 sphincters earlier. The second one, you've gotten through because they'll push their legs out, oh God, that doesn't feel so great. So that was a nice sign that I learned through the process. You want to push ozone so slowly so you don't puncture or blow up anything. And then pushing too fast can make them nauseated. Once you're done, I learned from Dr. Ferris, you can hold their tail down so that all the ozone is absorbed. It is a gas, so it could come out. So that's why you hold the tail down over the hole so that it doesn't come out. And then they usually need to poop afterwards. So I'm going to share this video of me doing it. So cats have 2 sphincters and he'll let me get through one. And you see how his legs moved right away. Camus is an incredible patient. So don't judge what your cat will do based on Camus. Camus lets you do most anything to him. The reason my mom is here petting him is because they have 2 sphincters. He'll let me in the first one, but not until he's relaxed will he let me in the second one. So we kind of have to wait a minute where he kind of forgets, gets calm from my mom touching him. My mom is his owner. So that's the best person to obviously do it. And then I just try to push it in to see if he'll let me go. And usually, and I kind of want to get it up 2.5 to 3 inches to that little mark I've made myself with a Sharpie. He's not letting me in. Something that I wish I would have understood so see how Camus is getting uncomfortable? I've had a half colonoscopy when I was awake and it's a very uncomfortable feeling. So the fact that he's moving his paws tells me that it's in where it needs to be. So once it's in, so then I'm gonna hold it in there and then slowly squeeze the ozone gas into it. I don't know the rate in which you do this, but I just try to go slowly. Okay, so on the catheter, I've marked 3 inches up, and the reason why is you're trying to target the portal vein in their rectum or anus. I don't know what it's called. I'm not a medical professional. So in a dog, I think I was told by O3 vets that it's about 3 inches up the rectum. In a cat, you don't really have to go up that far, but I just have that marker so that I know that it's, if basically only this is sticking out of Camus, then I've gotten to that portal vein, which is where you're trying to get in order to get the ozone inside of him. Somebody mentioned in the comments about the syringe that they saw in one of the videos. I did have to use a rubber syringe for a little bit, but yes, you want a silicone syringe. You want a syringe with a silicone stopper if you're going to reuse it a lot. But that's stuff like a veterinarian can talk about. So I also administered ozone on a cat, ozonated saline sub-Q. This is on Camus again. Administering ozone saline involves injecting a mixture of ozonated saline under the skin where it can be absorbed into the bloodstream to help boost the immune system and fight disease. Ozonated saline is best if it's cold, which is harder on the cat to tolerate. So with Camus, I had him in this box. I had a heating pad on the underneath a towel, and then I had the towel, and then I had Camus. So he was warm on underneath because it was pretty cold getting that ozonated saline in. You can keep the saline in the fridge and take it out when you're ready to bubble it. And you can bulk order saline on Chewy with a prescription from your vet. Oh, is it? Great. Okay. I don't think it was sharing, so I'm sorry about that. So there's that, but I'm going to show this other video. I take off the needle, make sure the bubble's up. And Camus is pretty skinny. So I try to lift up his skin. I try to see if the needle went through without poking myself. All right. And then what I try to do is I keep the skin up and I push in the ozonated saline. The ozonated saline has to be cold, and Camus doesn't like cold fluids. So sometimes he'll jet away when I'm doing this. And I literally just push it all in. Remove the needle. And we're all done. And that's how he gets his ozonated saline. Once it's in, I like to hold the skin up to kind of create a pocket to put the ozonated saline in. Camus gets uncomfortable with this, not only because it's near his kidneys that hurt, but also because it's cold water and he does not like cold fluids going into him. His lactated ringers we always warm before we give him the fluids. So I always hold after I give it to him. So the last thing that I did was ozonated saline orally on Camus, and I actually do this every day to my cats right now because it's allergy season. So another effective method of administering ozone therapy is orally with ozonated saline. This method is particularly useful for cats that may be resistant to other forms of treatment. Camus ended up needing it for necrotic tissue in his mouth. He was actually doing well, I thought, and we took him into Dr. Sally, and she comes out with a solemn face because it was the pandemic. So I was sitting in my car, the cat went in and was waiting for him to come back out. And she's like, Jenny, I found necrotic tissue in his mouth. And I'm like, okay, what does that mean? And she said, it's going to be pretty painful for him. You need to think about putting him down in the next 2 weeks. And I was like, what? He was like doing fine. What? So I said, well, what if we just put ozonated saline over that, and see what happens? And it healed in 2 weeks. And I'm pretty sure that that's what caused Dr. Sally to want to have ozone. I don't want to speak on her behalf, but she was blown away by that. And he ended up dying, I think, about 6 weeks later after that episode. So he was close to death anyway, but it did heal the necrotic tissue that was there. And I just went slowly on the side of his mouth. I didn't shoot it all at once in the back of his mouth because then you can get it in their lungs and that ends up being a problem. And with Camus, I've spot treated that necrotic. He had it back here. And so I just kept flushing it in that spot. Catters, we got something new in the mail today from Chewy.com. I order several bags at once. This is veterinary sodium chloride, 0.9%. I do ozonated saline on Charlie and Trick. I use a ozone generator plus a bubbler to make this ozonated, and I give it to them for their allergies. I just kind of slit on the side there and then pour it into the bubbler. Now normally I would refrigerate the saline because ozonated saline supposedly lasts longer. Then I just clip on it and put it in my refrigerator. Then I put the bubbler stem back in. I then hook it all up to the ozone generator and oxygen tank, and I'll let that bubble for about 10 minutes. I just pour it in a small glass with a syringe, and then I slowly give it to Trig. Make sure he swallows every time because otherwise he likes to cough. And Charlie's turn.
and then we're done.
That's it. So the biggest mistake that I made, and I have made it twice, so I didn't learn the first time, but is forgetting to turn off the oxygen tank. Because then you drain the oxygen and it's wasted, and then you have to go and get a new one. So just be sure that you turn it off and drain the line, because wasting oxygen sucks. Ozone therapy can be a safe and effective way to treat your cat with a variety of conditions. However, it's really vital to consult a trained veterinarian. What questions can I hopefully answer for you guys?
Awesome. Good work, Jenny.
Whew. I hope that people were able to see everything, because I'm not sure if I technically did that right.
No, you did great. You want to stop sharing your screen,
Sure.
and that way it'll make these videos a little bit, or pictures a little bigger. Great. That was really good. You did an excellent job.
Yes.
Good job. Okay, so we are actually bumping up against 12 o'clock, which is a first break. But before we go to that, let's try to answer a couple of questions if we have them, okay? So I know you already answered one or two during your presentation. So what questions there's no one who asked questions in the question area. But let's see if we have any in the chat.
So, Jonathan, one is, can distilled water be used with ozone instead of saline? I believe that's yes.
Yep, especially, if you're not using it in the eye or internally. So you don't want to put distilled water subcutaneously. And it's not going to hurt the eye. It's just nicer, better to use
like for
saline.
soaks or something, you would use distilled?
Yeah. Yep.
Okay. Another one said the oral ozonated saline is used for rinse versus kitty swallowing. No, it can be used for both. Sorry, I should have clarified that. My current cats swallow it, and Camus swallowed some of it, but because I was trying to flush that necrotic tissue, I was doing more than he would be able to swallow. I mean, with my current cats, you have to go slow. I just do a half mil at a time. They swallow, I do another half mil. But with Camus, I kind of had his mouth down, and then I would just shoot it so it'd flush and fall out of his mouth. He was getting enough rectally and sub-Q. He didn't need any more anyway.
Thank you, Jenny, again for being with us today and for lecturing. It was great. And we'll see you guys here in a second. So, all right.
Bye.